Hi, I'm Dr. Rosanna Sita at Togetherness Therapy. If you've been thinking about starting therapy for previous sexual assault, whether it's something recent or, years and years ago, you might be wondering, what am I getting myself into? And that's fair. So I'm making this video because I want you to feel confident and informed about how we at Togetherness Therapy work with survivors using a trauma-focused step-by-step approach. When you start with us, you'll begin a type of structured healing called trauma-focused cognitive behavioral therapy, or TF-CBT. Think of it as a healing roadmap, usually lasting between 12 and 18 sessions, depending on what feels right for you. The approach is flexible, meaning we always adjust to your needs, but the structure gives us a solid direction for your healing. Every therapist at Togetherness Therapy is well trained and experienced in using this method, so you can trust that you'll be guided and supported by someone who deeply understands this process. When we start, our first session is about getting to know you. It's, what's bringing you in? Where are you at in life right now? What are you hoping for your future? You absolutely do not need to share the details of your trauma story in this session. Instead, we focus on getting to know you, setting some goals together. We'll also talk about some common experiences after trauma, like feeling on edge, nightmares, flashbacks, avoiding reminders of what happened. Our goal is to help you understand these responses so you know that you're not alone, you're not crazy, you're not broken. Each session has a clear focus. And most weeks, there's a bit of homework, kind of a lot of homework, to practice new skills and reflect between visits. Some weeks there's more homework, some less, but if anything feels like too much, you just let the therapist know. Remember, you set the pace. Early sessions involve learning how your thoughts, feelings, and actions are all connected. We use something called an ABC worksheet to help you spot the patterns in everyday life, so not just related to the trauma, but every day. Over a few weeks, you'll get really good at connecting these thoughts, feelings, and actions. Next, we'll move into what's called an impact statement. So this is a written description of how the event impacted you or shows up in your life today. An exploration of how the experience has affected you and how you see yourself. Over the next few sessions, you'll work on a trauma account. This is a retelling of the event, and variations of that will expand as weeks go on. You'll have time to work on this at your own pace. If you're not ready when it's assigned, just talk it over with your therapist. Again, we'll always adjust as you need. When you are ready, you'll read your impact statement and your trauma accounts out loud in session. And together, you and your therapist will look for what we call stuck points. So these are things that are keeping you stuck, thoughts that are keeping you from moving forward. These might sound like self-blame or overgeneralizations. There are no judgments when we hear a trauma story, especially around issues of sex and sexuality. We are a sex-positive, affirming practice, and the focus is always on helping you identify and gently challenge these stuck points. For clients with more than one traumatic event, we'll choose together where we direct our attention. We'll keep expanding your statements, exploring your current and past feelings, and looking for patterns in thinking. Once we've built that list, we'll dig deeper, exploring themes like power, control, safety, intimacy, and how you see yourself. Together, we'll work through these stuck points from these different angles, always at a pace that feels manageable for you. If you need to slow things down, as I've said, if you need to take a break, that's totally okay. But I'm gonna ask that if you start this, you don't quit, because you're so close to a really important breakthrough and life change. I know it's a lot, and some weeks will feel hard, and that's because it is. But imagine the changes you can make in just a few months, especially if these thoughts have weighed you down for a decade. It's like just a few months, you can do this. So if this sounds like the kind of structure yet flexible support you've been looking for, I hope you'll reach out to us at Togetherness Therapy. You can schedule a consultation call right on the website. And again, every therapist on our team is ready and able to work with you on every step of this process. We hope to meet you soon. Thank you.